well, my talk was dealing really with some of the drivers that can induce transformation from MGUS to myeloma that are not genomic or epigenomic based. So mainly the main two non-genomic drivers are the immune microenvironment. I didn't talk about immune microenvironment. We had very nice talks from the group of Irene Gabriel, and my talk was mainly focused on the bone marrow microenvironment, the non-immune microenvironment. This is the mesenchymal stromal cells and the epithelial cells. This is a work that has some difficulties because these cells are very rare cells that are in the bone marrow, and being able to isolate those cells and interrogate is part of the difficulties and why not many groups are working with those type of cells. So what we've found is that there are significant changes from the MGUS stage to the smoldering myeloma to the myeloma to the full symptomatic myeloma stage in those two populations. And some of those changes can actually be contributing to the development of the disease and even to the resistance to therapies.